If you have a child susceptible to ear infections, you may want to look into Eustachian Tube dysfunction. Dr. Randy Reel is an ENT physician, and he joins us now live with more on this. How you doing, Randy?
I'm doing great, Sheldon. Thank you.
All right, let's just get right to the basics. What is the Eustachian Tube?
Well, the Eustachian tube is a little small structure that's about 2.5 inches long. It's a tube that runs from the back of the nose into the ear, and its function is to open and close and equalize the pressure between the inside and the outside of the ear. So it's a small structure that can cause a lot of problems and a lot of discomfort.
Yeah, and how does it normally work?
Well, there are two muscles that really anchor the Eustachian tube, and it's a dynamic structure. It has to open and close at the appropriate times in order to equalize that pressure. It's those muscles that open and close it.
And what is the Eustachian tube that makes it susceptible for children to have more problems with it than say, adults?
There are a few things that cause the Eustachian tube to cause problems in children that makes them more susceptible to ear infections than adults. And this is the reason that children get more ear infections than adults. And one of the things is the angle of the Eustachian tube. Up to about 18 months to 2 years of age, it's almost a downhill angle from the back of the nose. And there's always bacteria in the back of the nose, so it's almost like those bacteria have an easier path to get to the ear. It's almost like a downhill path to get to the ear to cause those ear infections. And as the child ages and matures a little bit, the angle of the Eustachian tube increases so that it becomes more of an uphill climb. That's one thing. Secondly, the cartilage of the Eustachian tube is not fully developed until a child is about 18 months to 2 years of age also. And the two muscles, the tensor veli palatini and the levator veli palatini, that attach to that cartilage, if the cartilage is not well developed, they can't open and close that Eustachian tube appropriately. And the third thing is that children of that age often have large adenoids, and the adenoids sit right at the entrance of the Eustachian tube and can pass bacteria into the entrance of the Eustachian tube and also prevent the equalizing of pressure.
So what are the symptoms that, say, parents want to look for with this type of dysfunction?
Well, we normally see a continuum of signs in the ear. The first thing is that when the Eustachian tube gets closed off, all the air in the middle ear will get absorbed, and it'll cause the eardrum to retract and get sucked in, and that can cause fluid to form in the middle ear, and that fluid can become infected. And so it's really fluid and blockage of the ear pain, and ear infection.
Is the cause of this dysfunction in adults the same for children, or does it change up?
Well, it's a little bit different in adults. Some of the same factors are present. Adults can have large adenoids at times, especially in smokers, and you can have masses back in the nasopharynx where the adenoids sit in children. As a person ages, the adenoidal tissue is usually sort of absorbed and it goes away. But in some adults it stays, especially if they're smokers, and then a mass can form back there in adults, and it can block the Eustachian tube also. Also, some people are just born with smaller than normal Eustachian tubes, and that makes them more likely to block. Allergies, upper respiratory infections, sinus infections, all those things can cause it to swell and block.
Okay, well, hey, we appreciate it. The ENT, Dr. Randy Reel, we appreciate your time today on the Noon News. We'll see you later, okay?
All right, Sheldon, thank you, man.